All right, good morning, everybody. Thank you for joining us. Today, I'm actually going to talk about the SMP, the Senior Medicare Patrol Program. My name is Lonnie Hitchcock, and I'm the program coordinator for the state for SMP. So, welcome to our Medicare Mondays. I want to thank everybody for joining us. So, Senior Medicare Patrol, what we actually do is we help prevent healthcare fraud, waste, and abuse. So this thing is how you can help prevent healthcare fraud. So what is the SMP and what do we actually do? SMP actually stands for Senior Medicare Patrol, and we help beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, waste, and abuse. We actually help preserve the integrity of the Medicare program, and we actually rely on volunteers. And I see we've got a couple of several of our volunteers on the call today, and I want to thank you all for joining. So the mission of the SMP is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. And of course, today's webinar is actually part of our outreach and education. So what is Medicare fraud? Medicare fraud is the intentionally billing of Medicare for services that were not received or billing for a service at a higher rate than is actually justified. And I'll be giving some examples later. So what is Medicare abuse? This is providers supplying services or products that are not medically necessary. And I'll give some examples of those later also. So here's some examples of Medicare fraud and abuse that I've been dealing with. Billing for services, supplies, or equipment that were not provided. In the past, I've sent to the Office of Inspector General, who most of my referrals go to. For example, this gentleman, he did not receive his diabetic supplies, yet they were the claim was submitted to Medicare for payment. Obtaining or giving a Medicare number for free services. This happens all the time. We've got that scam that's going around right now, that brace scam, where the scammers are telling the beneficiaries that they can get braces for free if they'll just give their Medicare number. Claims for services that are not medically necessary. We had the genetic testing scam here last year. So those where, they said that they could, detect cancer and stuff like that. A lot of those tests were not medically necessary. They're actually was not written by their, primary care physician or anything like that. So those are actually Medicare abuse. Another one is using another's Medicare number or letting someone else use your Medicare number in order to obtain services. I've had a couple of these where an individual let, like, for example, a younger sister or something like that, use their Medicare number in order to obtain services because they did not have any insurance. So here's the 3 steps that to prevent Medicare fraud: protect, detect, and report. So how can people protect from Medicare fraud? They can actually protect from Medicare fraud by, treating their Medicare number like it's a credit card. Don't give it out to strangers. Only give it to, your professionals that you're seeking services from. For example, your physicians, your durable medical equipment company that you're using. Don't give it out on these unsolicited phone calls that people get. Watch out for identity theft. So make sure that, because Medicare doesn't call people. So I've been telling, especially with these scams that's going around, I've been telling people, Medicare does not normally call people unless you've actually called Medicare first and left your name or number or something for them to call you back if there's a high volume of calls. They'll ask that sometimes. But you've actually made that first attempt to call Medicare. So it's these unsolicited phone calls where people are giving their Medicare numbers out to these scammers. So do not give your Medicare number out to anybody unless it's your doctor or something like that. and I tell beneficiaries also, don't carry your card unless you're going to the doctor. The good thing is that, everybody should have the new Medicare numbers now that are no longer Social Security number based. So that's a good thing. Another one of the scams is that they're going to be sending them a couple different ones. A plastic Medicare card. Social Security is not going to be sending out plastic Medicare cards. That's too expensive. They're going to be sending you a, chip-enabled card. That's not true either. The Medicare cards are not changing. They're still going to be paper. They will never, ever, I won't say never, but I don't think they will ever be plastic because it costs too much to print them. And so how can people detect Medicare fraud? They can actually detect Medicare fraud by reading their Medicare statements, reading their Medicare summary notices or the explanation of benefits, statement of benefits, whatever that Advantage plan may call them. And comparing them with your bills or any statements from their doctors so that they're not, overpaying, or they're making sure that what's getting submitted to Medicare is actually the service that they did receive. For example, making sure that they're not getting charged, Medicare is not getting charged for an MRI, yet the only thing that they had was just a plain X-ray. Things like that. Make sure they're not getting double billed. Making sure it's what the doctor ordered, things like that. So making sure that they can, keep track of those. Another good thing that I actually hand out to beneficiaries is called a personal health care journal. You can get these from SHIP or me. A lot of the SHIPs in your area have these because I work very closely with SHIP. We actually co-train our volunteers. So that the journals, you can keep track of your appointments, what happened during that appointment, what services the doctor ordered, anything like that. I've even had some where the doctor submitted a test, I can't remember, some kind of like a urine test, yet the beneficiary never peed in a cup or anything like that. I mean, that's actually fraud. It may not be that expensive fraud, but it's still fraud. So we still reported that. So another reason, a good thing is to report it. So if they do find an error or a mistake, it's to report it. Sometimes I tell the beneficiaries, call your provider just to make sure it's not an error. It's something that the provider can actually correct. If it's something the provider can correct on their end, it's better that way. That way, sometimes they do make mistakes. Sometimes it's a coding error. The coder has actually coded it wrong. So sometimes the providers are more than willing to correct whatever the mistake is. The problem is when the providers are not willing to correct their mistake or anything like that. That's when, you need to gather all the information, and that's, your bills, your MSNs, EOBs, and then, give me a call. And then we can go from there. Or, if you don't want to go through me, you can more than, willing to call the Department of Health and Human Services Office of Inspector General toll free. I've got their name listed, the number listed on the slide too. So people can either give me a call or IIG. It doesn't matter where you report it to. It just matters that you report it, because we can't do anything about it unless it's reported. So here's my I actually do have a toll-free number. I do work the whole state. So here's my toll-free number. For the S&P program, it's 1-866-836-7677. So that's, again, my name is Lonnie Holloway Hitchcock. I'm actually in the Cookeville office of the Upper Cumberland Development District. But as I said, I do work the whole state. So here is my contact information if you need to get a hold of me. And that the toll-free line actually rings directly into my office. Most of the time you will get me unless I'm actually on the phone or out doing, one of these webinars or something like that. And if you do get please leave me a message. I will call you back. So, since we're in the middle of open enrollment, I thought I'd start talking about enrollment fraud, and can they do that? Because we have a lot of insurance agents out there roaming around trying to sell Advantage plans and things like that. So I thought I'd touch a little bit about enrollment fraud. So here's some things to remember during open enrollment. Know the rules about how plans and agents can contact or market their plans to you. Right now, there's some things that agents cannot do, even not during open enrollment. So know how to avoid potential enrollment fraud, know how to protect yourself from enrollment fraud, and know how to report suspected fraud. So here's some things, that's the 4 things to remember. So how to avoid enrollment fraud. And so this is some things that I know people need to watch out for. Make sure the agents or whoever you're talking to is not pressuring you with time. Now, I know during open enrollment, which is October 15th through December 7th, we actually do have time limits. So we actually have to, in order for them to change, Part D plans or Advantage plans for next year, we actually have to have the enrollment in by, midnight, December 7th. So we actually do have a time limit. But if you're doing this early enough, they can't pressure you like you have to pick the plan right now. You've got up until December 7th to pick it. So keep that in mind. So if they're pressuring you, like if they're saying anything like, you're going to lose your Medicare, or, if we don't change it today, you're not going to have, it will never be changed or anything like that. That's the people you need to watch out for. Make sure if you're there during like an educational session, because I know a lot of the insurance agents or the Advantage plan companies do educational things around towns. They'll set up and do like an educational thing, making sure that they're not asking for your Medicare number, Social Security number, anything like that, bank information at those events. If you're asking for information, they should not be asking for your Medicare number or bank information or anything like that. They should not be threatening you with loss of Medicare if you don't sign up. They should not be offering you gifts to enroll. Now, there's some caveats to that. If they offer a gift, they actually have to offer a gift to everybody, not just the people that enroll. And the gift can be cost no more than $15. So keep that in mind too. So if you're seeing them, offer, $200 gift cards or something like that, please get that information for me so I can turn them in. Agents, Medicare does not employ insurance agents. So if you've got an agent out there that says that they work for Medicare, you need to hang up on those, or at least get their information, then hang up on them, so that I can report them, because Medicare does not employ insurance agents. Agents cannot call uninvited. They cannot call you out of the blue. Unless you are a current client of that company. Like, for example, if a Blue Cross Blue Shield agent calls and you actually have Blue Cross Blue Shield, then you're a current client. If you're a current client of a company, that gives them permission to call you because you're a current client. And that also goes for any of the TennCares out there. Blue Cross Blue or Blue Care, United, and Amerigroup. If you're, in one of those companies, you're a current client of that company. So that actually gives them permission to call you about your Medicare. I have a lot of beneficiaries that don't understand that they're, even though they have Blue Care or they have a different type of Medicare, and then they have Blue Care, TennCare, they're not understanding that they're a current client of Blue Cross Blue Shield. So, but be wary of those unsolicited phone calls from agents. Just, hang up on those people, or at least give me the information and so I can report them, because they should not be cold calling people or showing up at your house or anything like that. That's definitely a no-no also, unless you have an appointment with them. So some other things to report. Protect your Medicare number and Social Security number. Don't give it out. Be wary of unsolicited phone calls. Rely on government websites and emails from unbiased information. For example, the government website for Medicare is medicare.gov. There is a website out there that's called medicare.com. That is not the government website. and it actually has a little thing at the bottom or whatever that says it's not, not federally supported website or whatever. In order for them to have like Medicare anywhere, they have to have that caveat on there that they're not supported by the federal government. So rely on the government websites, cms.gov, medicare.gov, things like that. Of course, and we've got our, TCAD website, or we've got our SHIP SMP web page. So you can rely on this because we are unbiased. Another thing, request translation services if you need it. So if you speak a different language, something like that. I know there's beneficiaries out there, if you have eyesight issues, they actually have, the Medicare New books that come in different languages. They have them in Braille, actually. They have them in larger print. So if you need something like that, you can call Medicare and they can send you a different Medicare New handbook if you're needing it. If you're talking to an agent or anything like that and you're needing a translation, let that person know that you're needing translation services in whatever, because we all have access to those services if you need it. Another thing I tell beneficiaries, confirm everything that an agent tells you before you make a final decision. Getting in writing. Check with all your providers to make sure that they take that plan before you ever sign up. And I'm talking, don't rely on what the agent tells you, because I've had to switch a lot of people's plans because the agent told them that all of their providers take that plan. Yet when they went to go to their primary care physician did not take that plan. So I tell all the beneficiaries, confirm everything before you what that agent tells you. Make sure you do your homework first before you ever sign up. And if an agent is going just to, give you information, stuff like that, and they're trying to pressure you into signing up right then and there, I would just ask that agent to leave. Because then, that's another red flag if they're pressuring you to sign up right then and there. So get everything in writing of what the agent's telling you, getting in writing. Don't sign an enrollment form unless you're ready to enroll. Just make sure you do your homework first. If you do find out like an agent signs you up for a plan and you told them you did not, you weren't ready to sign up, please get me that information, because I can most likely get you out of that plan into a different plan or back to your original plan or something like that. So, but I have to have the information on who the agent was and stuff like that so I can report that agent. And I actually have to have the agent's full name, because there are several agents out there, like John Smith. John Smith is not going to cut it. I have to have, John Smith and John Smith's phone number, because you don't know how many John Smiths is out here selling insurance. So I have to have a complete name and phone number. Any contact information is very helpful. If you can get a business card, that's even better. Beware of your rights on, to choose how you want to receive your Medicare coverage. There's several different options out there. So we will give beneficiaries all of their options. I said, do your homework. Another thing to check for is your annual notice of change. And all the Advantage plans and Part D plans sends out the annual notice of change. You should have already gotten one. If you haven't gotten one, you need to call your current plan and ask them to send you an annual notice of change. So another thing to think about, what fits in your budget. Does this plan cover all your drugs? Things like that. There's several things that you need to look for, especially if you're wanting to switch to an Advantage plan. I said you need to check with all your doctors, all your providers in your area, like your hospital that you're going to go to, your DME. Because you really never know. Make sure you check with all your nursing facilities, because you may fall and break your hip and you have to go to rehab. So make sure that you know what insurances they take, because not all of them all take all of the Advantage plans. So that's why you really got to do your homework. Let's see here. Oh, another thing, check the plan star rating. Is this a good plan or not? If it's rated bad, then I would kind of be wary of it. Ask around, and keep in mind that not all plans work for each, the same for each other. For example, if your neighbor has Blue Cross Blue Shield and it's working great for him, Blue Cross Blue Shield may not be the best for you because you may be on different drugs or have different diagnoses and stuff like that. So keep in mind, not all plans work best for the same people. So even husband and wives have different plans. So keep that in mind when you're looking at changing plans or whatever. And here's some rules that I give beneficiaries on, meeting with an agent. So if you agree to meet with an agent, like you have called wanting more information and say, okay, we're going to, send an agent to your home if that's okay with you, what's the best time for them to come out. So that's, you actually initiated that contact and set up a meeting. So during that meeting, the agent can only discuss with you what you wanted discussed. They can actually give you, plan materials. They can tell you how to get more plan information. Like if the agent didn't bring enough or, couldn't answer all your questions, they should give you a number for the plan that you can call the plan yourself. They talk to you about your plan options that you agree to discuss. They cannot sell you, like if you agree to talk about Advantage plans, they cannot go out there and try selling you any other type of insurance, like long-term care insurance or something like that. They have to do that in a totally separate time frame. They can actually give you an enrollment form. They can collect your completed enrollment form if that's what you want to do. They can leave your business cards for you to give to friends and family. You don't have to give them out, but they can leave them. It's up to you. They can't ask you, and they shouldn't ask you to give you names of other beneficiaries or anything, or numbers or anything like that. They can leave their business cards, but they should not ask you for other people's names and information or that they can call, because that would go back to being cold calling or unsolicited phone calls. So here's some more rules for meeting with agents. So here's some things that they can't do. They can't charge you a fee to process your enrollment. They actually get charged. They actually get paid by commission. So that's why a lot of agents are out there hitting the road, trying to sell the plans, because they are actually paid by commission. They can't steer you to a particular plan unless that's the only plan that they sell. So that's why I tell beneficiaries, do your homework. Check all the other different plans to see how they work. See if any of your providers take, any other different plans. So if they're trying to steer you to one certain plan, I would be wary. They can't communicate incorrect information. For example, like, they can't tell you that your provider takes the plan when in fact they don't. They can't tell you it's the best or the highest rated or ranked. They, they can't talk to you about, other plan options you haven't, agreed to discuss or anything like that. They can't pressure you into joining. They can't ask you to give names and phone numbers or anybody else, and they can't ask you to sign the enrollment form before you're ready. So if they are doing any of that, it should bring up a red flag, and that you need to probably escort them out the door and report them. So here's some examples of enrollment fraud that I've come across. I've had agents enroll beneficiaries into plans without their permission. The beneficiary had no idea how they got enrolled into that plan. They told the beneficiary that their physician does take the plan. And I had this happen several times this year where I've had to change beneficiaries to a different plan or back to their original plans. I had one beneficiary, she was going through chemo treatment, and the agent said, oh yeah, your provider does take our plan. But when she went back to get her second chemo treatment round, come to find out they did not take that plan at all. So that agent had lied to her. So she actually had to miss a couple of chemo treatments because I couldn't get her changed fast enough. So she actually missed that one treatment. She actually missed 2 treatments. Me trying to get her changed back to her original plan. So please, that's why it's very important for you all to do your homework before you ever change. Agents, we had an agent that was offering a free trip. If you signed up with them, they would put your name in a hat to win a free trip. So we actually had that. That actually did happen. I've had agents misrepresent the plan's benefits. They told this beneficiary that, or it could be they wrote them the wrong plan. I don't know which way it was, but they told the beneficiary that their premium for that Advantage plan was going to be 0. Yet I think they wrote them for a higher plan, so it turned out that they actually had a extra premium for that plan. Agent tells a beneficiary they have to sign up or that they will lose their Medicare. I've actually had agents do that before, that they had to sign up right then or there, or they were going to lose their Medicare. So if we have agents out there that are doing any of these that you've recognized, or any others, please get in contact with me. Give me that agent information so that I can report them. So since it is open enrollment, I thought I'd talk about some of the open enrollment scams that are going around right now. Right now, we've got people, bogus Medicare representatives. That's the scam calls I'm telling you about. They're claiming to be from Medicare and that you're going to be getting a new card, or that you can get free braces. I mean, they're doing all sorts of things. Get a new chip-enabled card. That's the only ones I've heard about right now. If there's any others, if you all hear of any other scams out there or fraud, please let me know. Just send me an email, give me a phone call, something to let me know so I can get that out there to everybody. I try to post something, at least on my Facebook page or anything like that, letting them know about the new scams, or I can do news outlets and things like that. So, please, if there's any new ones out there, please let me know. If they're threatening you loss with coverage, here's some other things: the fake rebate notices, counterfeit sales materials, and there's fake emails. Now, if someone is on an Advantage plan, the Advantage plans have to have a opt-out, like they can send their current clients emails, but they have to have an opt-out in that email thing. So if they're a current client of like Blue Cross Blue Shield, Blue Cross Blue Shield is going to be sending them emails out, but they can opt out of those. So of course, here's my number to report, enrollment fraud. If you see anything, make sure you save information. Save, documented proof, any signed papers, business cards, any, plan materials that they give you, phone records, anything that is helpful, so that I can put that along with the referral so that I can report them. So here's some current scams. I know there's a lot of different scams going around right now. I'm going to discuss some of those current scams that are actually going around. So some of the current scams, we've got several different COVID-19 scams I'm going to be talking to you all about. We've got that Medicare brace scam, we've got the Social Security scam, and we've got the IRS scam, all going around at the same time. So some of the COVID-19 scams that I've seen, I've actually had several doctors' offices contact me where they're getting faxes from the scammers, wanting signatures from the doctor for, mask, or, the COVID-19 test kits and things like that. So I've actually had the doctor's offices send me the faxes that they received. even though, you know, it's something they have, you know, they've denied because they haven't done anything like that. Most of the doctors have told me that, you know, if they have a patient that needs a mask, they're more than welcome to come to the office and get a mask. They don't have to write a doctor's, you know, prescription for it. They're more than welcome to come to the office and get one. So watch out for those. The free virus test kits in exchange for a Medicare number. We've had the scammers do that. We've had, you know, imposter scams using you know, COVID-19. We've had some people fake being the contact tracers. So most of the time, if they're a contact tracer, they will not be asking for personal information. They will not be asking for Medicare numbers, bank account, anything like that. Some of the other scams, you know, this is a kind of a thing off the grandparent scam where they, you know, call claiming to be a grandchild and they're stuck in whatever city because, you know, because of the virus and that they need money sent to them. Yeah, watch out for the stuff that's being sold online. Pretty much anything being sold, the test kits being sold online, anything all like that. Just be wary of those. You know, as I said, the phony coronavirus contract tracers, selling fake cures. So if you see any advertisements that, you know, that they've got the cure for COVID-19, that's all a scam. There's also been fake emails and text messages, claims, you know, senior was in contact with someone who had COVID, yet, you know, they needed, you know, money to process that or whatever. There've been emails or text messages ask people to follow certain links to that actually capture private information. So if you get, you know, if you get an email or a text message from someone, you know, you don't know, block those messages. Don't answer, you know, phone calls of numbers you don't know, because the scammers are actually spoofing local phone numbers. So it looks like they're calling, you know, locally, when in fact they're not. They're probably in some foreign country somewhere. So just be wary of those. Even if you don't recognize a local number, you know, don't answer it. Most of the scammers don't leave a message. Now, keep in mind the IRS scam, they're actually leaving a message that it's officer so-and-so, but I'll get with that later. But most of the time, scammers don't leave messages. So if it's someone you're actually needing to speak with you that's local, they'll most of the time leave you a message. So the brace scam, you know, they're calling, claiming, you know, to be for Medicare, or that they're offering free or low cost braces for your Medicare number. We've actually just had boxes of braces shown up at people's houses that their doctor or anything hasn't prescribed, yet they never actually spoke to anybody on the phone. Somehow the scammers got a hold of their Medicare number, but they never spoke to anybody. And also the, you know, doctor's offices have been receiving, you know, those, you know, faxes from the scammers for signatures for braces, even though the doctor never actually ordered it. So just keep that in mind. You know, if you get something like that, or, you know, you're at your doctor's office and the doctor says, hey, we've gotten a bunch of these faxes, you know, are you needing a brace or anything like that? And I tell beneficiaries, if you need a brace or something like that, go to your primary care physician. Don't rely on these scammers, because most of the time the stuff that they're sending is, you know, doesn't fit. It's not the right, you know, whatever. Your doctor can order you, you know, what you need, you know, because you actually need to be measured and things like that. So keep that in mind. So don't give out your information in these unsolicited phone calls. The Social Security number scam, these actually need to be reported to the Social Security Administration, Office of Inspector General. But some of the scams that's going around is that they claim to be an investigator with Social Security Administration, and that your Social Security number has been used, you know, fraudulently somewhere else. Most of the time, they're saying Texas for some reason, and that there's a warrant out for your arrest. So that's one of the scams. The other one is that there's an issue with the Social Security. and they're needing, like you to go, they've overpaid you or something, and that you need to pay them back, and that you need to go get like a green dot card or some kind of card to pay them back, and they have to have it right then and there. Most of the time, and I tell beneficiaries this, all of the federal agencies communicate by mail. So if there's really an issue with their Social Security will send you something, it will send you a letter in the mail. Again, if there's something wrong with Social Security, they will not call you and tell you that there's a warrant out for your arrest. If there's serious an issue with Social Security, they will send you a letter. So if you get any of these scams, they actually need to be reported to the Social Security Administration, OIG. And that phone number is actually 1-800-269-0271. Again, that's 1-800-269-0271. So that's the Social Security Administration, Office of Inspector General. Another good place to report these is also the FTC website, the ftc.gov, because they keep a lot of the different scams, and you can file a claim with them too. The IRS scam. There's several different IRS scams. Most of the time, it's you owe back taxes, and that if you don't pay them right then and there with whatever, that they're going to come and arrest you. That's fake also. And these actually need to be reported to the IRS. And there's actually, it's called phishing@irs.gov. That's where you need to report these type of IRS scams. So most of the time, if they're calling, claiming to be the IRS or, investigator with the IRS or whatever, just, hang up. I said most of the time, if it's an IRS scam, IRS will be communicating to you through the mail. So if you do get one of these, keep the phone number, ask for the employee's full name, their badge number, exact, get some, good information, exact date and time that they called, if you can get, where supposedly they're located. Any information so that you give it to the IRS is helpful. Any and all information. So here is my website, or my actually Facebook page. I'm trying to get up to 1,000 likes. I'm definitely not anywhere close to this right now. Right now, I'm just trying to reach 200. It'd be really good if I got 200. But here is my Facebook page, and I actually post daily, almost daily, except on weekends. Scams going around, stuff about the S&P, stuff about SHIP. So I put a lot of stuff out there. So please go and like my, Tennessee S&P page. So you can get some of these, fraud updates and things like that. I said I post pretty much daily on these if it's Monday through Friday. And it's a good way of getting information. You can also get in contact with me through this page if you need to. So I'm pretty much, done. I want to, thank you. Here is my information if you need it. Again, my name is Lonnie Hitchcock. I am in Cookeville. Here is my email address, my toll-free number. The 931-476-4144 is my direct office number also. So, the toll-free number and those two numbers will ring directly into my office. So if you have any questions, want to report fraud, please, give out my information, to anybody. If you're needing information about S&P, I'll be more than happy to send you, a packet, healthcare journals, brochures, anything and everything. I can send them out to you, or you can get with someone in your local area aging disability where our SHIPs are actually housed, because I send them a lot of my information also. So if you're ever close by, and we set up at health fairs and things like that. So if you're wanting something, give me a call. If you've got any questions, or new scams, anything like that, please don't hesitate to give me a call. So I want to open it up for questions now. And you can unmute yourself, or I don't know if, Olenka, can you unmute everybody?
I can. Let's see.
Okay, I was going to open it up for questions. Does anyone have any questions about S&P or anything like that?
What might be easier is if people like unmute themselves, just so that way we don't have too much background.
Yeah, you can unmute yourself if you need to, or you can also type a question in the chat if you need to.
Yeah, either one's fine. And I'll stop recording now, so feel free to ask whichever questions you have.